Hi, I'm Dr. Robert Beasley from the Palm Vascular Centers of Miami Beach and Coral Gables. I'd like to share my experience with Sublime Surmodics radial crossing devices. Radial is extremely important to me because my practice primarily centers in the vascular center, outpatient vascular centers. So the patient's ability to be released from the center without having a significant complication from a femoral approach is foremost when we do our work. What it does is it reduces the bleeding complications and access site complications that might be seen. It does increase our patient comfort, intra-procedure as well as post-procedure. The patients love it. They get to go sit down in a little chair and wait for an hour and a half, and then they go home. It's amazing. Again, the patient recovery and the early post-procedure ambulation is something that not only the patients love, but the referring physicians love as well. As far as the economic benefits, it's a multitude to our centers. The patients categorically have a shorter length of stay. They have fewer complications and fewer hospital readmissions. They have reduced nursing care per patient. It's very, very important in the outpatient setting. And if you do a couple of these patients at the end of the day, the nursing staff loves you because they go home an hour and a half later rather than having to wait for whatever time. We don't really need to use closure devices here. You have the transradial band, which performs great, so you have another cost saving there. And we have fantastic cath lab throughput. Again, marketing benefits for the facility and for myself personally is tremendous. The patients go back to their doctors and they say, you know, this Dr. Beasley has this device where he can go through my arm and treat my legs, and you know, I go home in an hour. They just love that, and then the doctors love that as well, and you see more referrals from that. And this can also be a differentiating factor from other facilities in our area. The positive publicity is amazing. So as a part of the radial toolbox, the biggest part of this when you're starting to get into radial work for folks that are kind of new to this is case planning. It is a necessity. You need to basically look at your patient, the length of your patient. The metrics are vital. The room setup varies so that you need to understand the pros and cons of the setup as well. And if you're just starting out, you need to stick with radial. It takes about 20 to 30 cases before you really start to feel comfortable with the approach. And the whole staff needs to be on board as well. And you need to understand devices that are available. So the Surmodics devices, you have 220, 250 catheters, 018, 014. The balloon sizes go up to 6 millimeters in diameter for the 018 and up to 4 millimeters in diameter for the 014, and they are in lengths up to 220 millimeters. So the Sublime platform is amazing. It, to me, has, as far as the balloons go, some of the best crossing and best pushability of any of the balloons that I have tried up to date. And then if you want to add atherectomy to your procedures, you know that there's a CSI device out there that goes 200 centimeters, and they have multiple sizes of crowns, so you can get all the way down into the popliteal and into the tibials for treatment. And you also, if you do need to have a stent because you might worry about what if I have a dissection, there is a stent that is available in 200 lengths. So anyway, I just wanted to give you my experience with the Surmodics platform and to relay how grateful I am that they were able to come and provide this leap in technology for us in treatment of our patients in peripheral vascular disease, critical ischemia via the radial artery approach. Thank you.